Good afternoon. I want to ask all of us to please turn off our cell phones, or at least turn them to silent and make sure they're off the table. Also, everyone with Blackberries, please make sure your Blackberries are also off the table so we can avoid feedback. My apologies. You may notice board members accessing their laptops during the meeting. They are using these laptops solely to access the board meeting materials that are in electronic format. The board welcomes public comment on any items on the agenda, and it's the board's intent to ask for public comment prior to the board taking action on any agenda item. If for some reason I forget to ask for public comment on an agenda item and you wish to speak on that item, please raise your hand and you will be recognized. I would like to remind all speakers to complete a presenter slip. They look like this. They're in the back of the room, and give them to Mr. Einer. Would you please raise your hand? This is our new administrative assistant, and he will be happy to receive these and bring them up here. I will do my best to call upon everyone who supplied a slip for the agenda item and recognize those who wish to make a last-minute comment. But you will still need to fill out a speaker slip when you're done, and that way we'll have it for the record. I want to remind all speakers to please stay on topic and to keep your comments to 3 minutes or less. We will end the meeting around 5 p.m. today and resume again tomorrow morning at 9. I'd like to call the meeting to order. Welcome our new administrative assistant, Mr. Einer, and ask you to please call the roll.
Dr. Bishop?
Here.
Dr. Carrion?
Here.
Ms. Ching?
Here.
Dr. Diego?
Here.
Dr. DeRusso?
Here.
Dr. Gonadev?
Here.
Dr. Levine?
Here.
Dr. Lowe?
Here.
Dr. Salmonson?
Here.
Ms. Shipsky? Ms. Yarvilowski?
Here.
Thank you.
Thank you. We have a quorum present. It is my pleasure to announce the appointment of 2 new members of our medical board, both appointed on December 21st. Dr. Michael Bishop is the Director of Anesthesiology for same-day surgery at the University of California, San Diego, Hillcrest, and is an attending anesthesiologist and clinical professor of anesthesiology at the University of California, San Diego. Dr. Dev Gonadev is a surgeon and medical director at Arrowhead Regional Medical Center in San Bernardino County. Would you gentlemen please step forward and come up here, and I want to administer the oath of office. Oh, it's just they want to take a picture, so you might as well just do the whole thing over here. Not my idea of entertainment, but somebody thinks it's fun. This is fun. This is fun. Don't worry. So, would you please put your hand up in your right hand, please, and state your name in the appropriate place, okay? I,
Michael Bishop.
Dave Granaday.
do solemnly swear, you do that,
Do solemnly swear
that I will support and defend
That I will
that I
support
will
and
support
defend
and defend
the Constitution of the United States
the Constitution of the United States
and the Constitution of the State of California
and the Constitution of the
State of
State
California
of California
against all enemies, foreign and domestic,
against all enemies, foreign and domestic.
that I will bear true faith and allegiance
I bear true faith and allegiance
to the Constitution of the United States
to the Constitution of the United States
and the Constitution of the State of California,
and the Constitution of the State of California.
that I will take this obligation freely
I will take this obligation freely
without any mental reservation
without any mental reservation
or purpose of evasion,
or purpose of evasion.
and that I will well and faithfully
And I will well and faithfully
discharge the duties upon which I am about to enter.
discharge the duties upon which I am about to enter.
Congratulations.
Thank you.
If you'd like to give a few words of wisdom or comment, you're welcome to do so. You can have the time it takes to walk back to your seat.
Words of wisdom are very hard to come by at a moment's notice. I'm just very grateful to have this opportunity to be a member of the board, and hope that I will fulfill the obligations in an exemplary way.
Thank you. Dr. Gonadev, would you like to say something?
Thank you, Madam Chair. I'm thrilled and delighted to be here. When I came to California, I was just a poor little surgeon. This profession has been good to me, and this is my time to dedicate and donate to the profession I love. That's why I'm here.
Thank you. Thank you both very much. Welcome, and we look forward to working with you. I do have one public speaker comment, please, for something not on the agenda. Frank Cuny, would you please come forward and address us? And welcome.
Thank you, Madam Chair. My name is Frank Cooney. I'm the Director of California Citizens for Health Freedom, and I know I've been to over 40 board meetings for a long time, which is probably more than any other board person here. And I want to first compliment the new board members that come aboard and wish them luck. I do want to say that the California Medical Board is much more important than just the California. It has influence over the other states, that a lot of the other states look upon the California Medical Board as possibly one of the best in the nation and a good example to follow on what they're doing. And you've had very active people on your board, and particularly your administration is really good. At one time you did not have good administration way back, and it's been nice to see the change and the growth of the administration of the board onto it. And one of the things the board has done in the past, they supported a bill that they not only supported the bill, they did the bill on non-conventional medicine that allows physicians to do complementary medicine as long as it's safe and effective, and we're one of the few states in the nation that do that in the holistic health area, that physicians also are involved in the holistic health area. And I do hope that sometime in the future you will also do the same on the issue that we want of holistic treatment of cancer, the alternative treatment of cancer to become legal in California. It is one thing that's been an obstacle in California to physicians doing good holistic healthy treatment of cancer, and other physicians who'd like to come to California don't come because of that law. And I hope we have an author for the bill. We won't be doing it this year, but we will be doing it next year, and we hope the medical board will join in its support. Once again, thank you for the time very much and the service you provide.
Thank you, Mr. Cuny. We appreciate your comments at this meeting, and especially today. I'm going to move to item number 4 on approval of the minutes for the October 27th, 28th meeting. Are there any additions or corrections to the minutes? May I have a motion to approve them as submitted? Second? Is there any public comments? Seeing or hearing none, I ask all those in favor, please say aye.
Aye.
Any opposed? So, pardon me?
I wasn't there, can I?
So you shouldn't be voting.
Yeah,
I
and
abstain.
I was sick. I shouldn't be voting either.
So those that were not there should not be voting, and they'll be abstaining. So we have 3
Abstain,
abstain.
3
Thank you,
abstain.
3 abstain. So we still, okay. So the minutes are approved as submitted. Now I'd like to ask Ms. Kirchmeier to please come forward, and we're going to move to agenda item number 5, which is a discussion of the strategic plan, objective 5.4, annual review of committees and the establishment of board committees. So you're going to lead us through a discussion on this, okay?
Yes, I am.
Thank you.
Good afternoon. If you will please turn to tab 5, which is page 50 of your board material packet, you will find the background on the board committee review. As you may recall, at the last meeting, we were going to review and discuss the board's committees according to objective 5.4 of the new strategic plan. Unfortunately, we did not have time and had to table this discussion. In order to expedite the process, we sent out a survey to all board members asking for their input on the committees of the board. On pages 50 to 50.7, you will find a consolidated report of the information provided from the members for each committee of the board. I want to thank the members for providing information to us so we could put this information together. Then on pages 50.8 to 50.14, you will find attached the board's updated committee document, which includes the current responsibility of each committee, as well as the staff assigned and the current membership as of October of 2011. This document was requested by one of the members, so it is also included in your packet. I would like to go through each committee individually to determine if the members would like to keep the committee, change the goals of the committee, change the meeting times for the committee, and so forth as we go forward. We'll be walking through each one. So unless there's any questions, I'd like to just begin with the executive committee. Okay. So if you'll turn to page 50.1, you will see there the information on the executive committee. Based upon the members' comments, it appears this committee should remain as is with one exception. One recommendation was for the committee to do a periodic assessment of the members to identify perception of effectiveness and efficiency of board meetings and suggestions for improvement. As some of you may remember, the board used to survey members at each meeting, but maybe the executive committee would like to do an annual survey to see what, if anything, needs to be reviewed and changes made. This could be an issue for this committee. Unless anyone has anything to add, I would like to ask for a motion to add this as an issue and also get a motion to keep this committee as is with this addition. The committee would meet when needed and may meet at the quarterly meetings or in between if necessary, definitely under legislation if there's issues that arise.
So is there any discussion on what's been presented as far as what the responsibilities of the executive committee should be, times they should meet? So may I have a motion to approve them?
So moved.
Second? Any public discussion? All those in favor, please say aye.
Aye.
Opposed? Okay, so.
Okay. Let's turn to the licensing committee. This committee, based upon comments, should also stay the same with the addition of maintenance of licensure as an issue for the committee to discuss and a minor edit to the wording. And you can see the comments there if you turn. Basically, they're at the bottom of page 50.1 and at the top of 50.2. So unless anyone has anything to add, I would again like to ask for a motion to add this as an issue, basically the maintenance of licensure, and also get a motion to keep this committee as is with this addition. This committee in particular would meet at quarterly meetings when issues arise that need discussion, when they basically have a full agenda.
Okay, the licensing committee, I want to point out that having staff prepare presentations on various licensing processes helps the board members to understand the licensing programs and support the decisions being made. So it's an important function to be engaged in.
Madam, I'm sorry,
Yes.
Madam President, I just want to, Kim, I have a question on 50.1, the 2A through E. I'm just inquiring whether, if I'm not mistaken, what we just saw for SB 100, the SB 100 outpatient surgery centers and PolySom as well would probably fall under the licensing committee.
Yes,
Okay.
based on what we just saw. And we can add those as items. And that would be in the role of the licensing committee regarding the outpatient settings.
Okay, let me also interrupt before we continue. Tina, I have a speaker's slip from you. Did you want to speak on specifically on 5 at the end? Now, when? At the end, okay, thank you.
Can I?
Sure,
Sorry to
Dr. Levine.
interrupt, But my page for the licensing committee is 50.11. Am I using the wrong?
You could be on 50.11.
Yeah.
Can you, will it back up to go to 50.1?
I'm just wondering if I'm using the wrong. No, it looks like a different.
Yours is, 50.11 is committees created by the board continued. Is that the title of the page? Okay, so then you might be in the right place with the wrong number.
50.1.
Okay, thanks. Not yet, but I will get there. Thanks.
Does, Dr. Levine, does 50.11 say committees created by the board continued? Is that what you're looking at? Yeah, just if you scroll up, you'll, okay, all right. So again, I would entertain a motion then with adding PolySom and outpatient to the list on number 2, A through E, and again, ask for a motion to add in maintenance of licensure as an issue, and that the committees would meet quarterly when a full agenda is achieved and when the need arises.
Second.
Any comments from the board? Any public comments? All those in favor, please say aye.
Aye.
Any opposed? Okay, that continues, please.
Okay. Enforcement Committee. From the comments, it seems this committee also should remain, and it appears the issues identified are appropriate. There were no new issues that were brought up from the members. So unless anyone here today has any issues to add, I would like to ask for a motion to add the, keep this committee as is, and that we would meet at quarterly board meetings and again when needed for this committee. For this committee also, there are subcommittees which may need to meet in between if necessary.
Any comments from questions from any of the board members? Any public comment? Can I have a motion to approve the enforcement committee as a committee, please?
So moved.
Second?
Second.
No comments, correct? No public comments. Okay, all those in favor, please say aye.
Aye.
Any opposed? Okay, so that's
Okay,
done.
all right. Moving on then, you will see at the bottom of page 50.2, for the statutory committees, there was just one comment, and actually from the licensing committee, this was also brought up there today. The comment had to do with the special faculty review committee, and we can see from the comment in page 50.2 at the bottom, in speaking to Mr. Ward, and this is an issue that he's going to be bringing forward and will be looking into the future. And that was again on the 2168 candidates and follow-up data on those. Okay.
I have a question on this committee. Is there material or issues that warrant this committee to be meeting on a regular basis versus as when needed?
For the Special Faculty Permit Review Committee, they're the group that looks at 2168s. So they meet they meet when they have applications in that have been finalized and that are ready to go before that committee.
Okay, thank you. May I have a motion to approve that committee?
And actually, the motion would be to
I'm sorry,
keep all of the
so
statutory
continue.
committees, and
I
I'm not sure
apologize.
that you even need a motion to
No,
be legal
continue.
counsel. Okay. All right. So moving on to Access to Care Committee, at the top of page 50.3, I would like to ask the members to have a discussion on this committee. One member had asked that what the committee had done previously. In looking at the minutes from this committee, it was started in 2007, and the one issue that came from this committee, as some of you may remember, was Assembly Bill 329 by Dr. Nakanishi regarding the creation of diabetes telemedicine partnership with UCD. We remember we had a presentation at the July meeting regarding this program. This committee does have a policy statement that was previously adopted in 2007, and I've asked Mr. Einer to hand that out to you just so you can look at it. From looking at the policy, it doesn't really provide goals or objectives for this committee. It really is just more of that, just a policy statement. It really doesn't have specific issues. Other issues discussed by the committee include physician volunteers, physician workforce, minute clinics, but no actual document or issue paper came from the committee other than Dr. Nakanishi's bill. The product of this committee work really has to do with education, both to the public and to physicians. So in looking at the comments and based from input from members, a recommendation would be to combine the Access to Care Committee with the Education Committee. So unless there's further discussion on this, I would like to ask for a motion to combine this committee into the work of the Education Committee.
Yeah, second.
Can I ask? So what you're saying, see, I thought Education Committee is just to come up with ideas to educate people. Access to Care is maybe come up with ideas to increase the access to cares. So what you're saying is, if we move that into an educational committee, the access to care issue is becoming an educational issue. Is that what you're saying?
From what
They're becoming a we will only educate on the matter of access to care.
Yes, Dr. Levine.
Yeah, I'm not sure either. That's why I'm just trying to see. I look at access to care as one of the most important issues in California after 2014. You have millions of people coming on some type of coverage, and you don't have primary care doctors, especially in rural areas and inner cities. So I'm not sure. it looks like we haven't really defined what this committee's role is. That's our issue rather than existence of the committee. So combining with the medical education, there are two different functions. If one function takes over the other and does not put enough guidance from the medical board and access to care, I think we'll be in deep trouble as the consumers of California. So my issue is what can we do to really define better what this committee is supposed to do?
Dr. Levine?
Yeah, and so here's one perspective, which is that I can't agree more that access to care is a serious issue today for California, in particular in terms of a primary care workforce. The question is, what is the medical board's purview and role beyond educating itself and its licensees and the public around the issues around access to care, with the emphasis on education? Because many of the issues around access to care have to do with reimbursement, they have to do with workforce, and they have to do with insurance issues. Mm-hmm. And so trying to find the place where the medical board can add value in that range of issues, one way I would think is through education, and I think that's where the idea of education came from, because many of those elements are not directly under our licensing and core missions of licensing and enforcement.
So let me ask the question. You gave us one example of something that's happened since 2007. It was a piece of legislation that came out of that committee. But I'm sure in 4 years that the committee has been meeting that there had to have been other things on the agenda. Could you give us an idea of what those might have been?
Yeah, the other items that were physician volunteers and physician workforce. Minute clinics were a discussion item, and that was really, for the most part, the list that we had looked at and looking at the minutes.
Okay, thank you. Dr. Lowe, did you want to speak?
Yes, I think none of us would argue with the concept of improving access to care, but it's beyond the scope of the medical board to deal with the problem, and it's unlikely, no matter what we do, that we're going to really significantly impact access to care. So while I support the concept, I don't think we have a role with that committee. Secondly, I was not overly impressed with the efforts on the diabetes education program, and I was really unimpressed with the return on investment. And I just don't think that it's our role to spend that kind of money to have those kinds of results. And so I think there's little place for access to care in this medical board environment.
Ms. Chang?
Well, with the new healthcare reform becoming effective, there's the, I guess, part of the new concept is, distribute the work down from the doctors down to the PAs, the nurse practitioners. Now, with that, it's to understand how that will work and to structure how that will work to ensure the quality of the care of the patients is really truly, to me, is an access to care issue. I know, but I know we cannot increase medical schools or increasing doctors or in a state that's truly beyond our scope. But we really have to look to see what the new model would bring and how to ensure the quality of the care of the patient. And I guess I'm repeating myself. I'm trying to say that's where access care needs to be. I have a hard time accepting the fact that we're just educating. I think Education Committee has its own goal, and the Education Committee should take all the issues that we deal with, the access to care, the enforcement issue, and all that. But it's difficult for me just to combine these two together.
Dr. Solomonson?
Well, you know, and I agree with the comments made by a lot of people that access to care as a standalone just didn't seem to have clear goals. Now, I guess I'm thinking put it somewhere and rename it something so its name isn't lost perhaps, but I'm thinking also of this advisory committee on physician responsibility in the supervision of allied healthcare professionals. I do think going forward, we do need to work on that model, certainly, as far as, you know, healthcare delivery. And in a way, access to care kind of dovetails with allied healthcare professionals, and I personally don't think when I was in medical school I got anything on how to work with allied healthcare professionals, and just a thought, that's another committee that I think, I mean, maybe it needs to get a new name, but the concept of working with allied healthcare professionals is certainly a way, I think, to improve access to care without losing quality.
Dr. Ganadev and then Dr. Lowe.
Yes, if you look at Steve Thompson Loan Repayment Program is access to care. There is significant value there. J1 Visa Program is access to care. There are places where we can guide and assist others, our partners or our customers, to really get that issue, take that, and maybe it's not the mission of medical board. I look at it, it is. Quality, best quality care for all Californians is the mission of Medical Board of California. So I don't take that it's not our mission to really look into access to care.
Dr. Lowe?
I take issue with that. I think that, you know, our charge is to protect the public. We need to do licensing and enforcement well. That's what our focus should be. If we could solve the access to care problems, we should be running the country. We cannot. We don't have the resources. We don't have the time. So I say we do what we're supposed to do and do it well, and we leave these other problems to other people that can solve these problems. We just don't have the resources. Our income comes from our licensees. Are they supposed to be supporting the solution to access to medical care? That we can't afford it. They don't pay enough. We just can't do it. This is not the committee to solve the problems with access to care.
Okay, I'm going to suggest, Dr. Levine.
Just one other comment. The phrase access to quality care, I think, actually does fall under the purview of the board, but it's the quality of care piece. And we attend to that through licensing, enforcement, and many of the other things the board does. And I agree with Janet that one of our responsibilities in terms of assuring access to quality care is clarifying, and as some of the suggestions around the Advisory Committee on Physician Responsibility in the supervision of allied healthcare professionals, is to ensure that scope of practice issues are clear, that physicians understand what their responsibility is in terms of overseeing medical assistants, PAs, advanced practice nurses, etc. And by doing those things, we are contributing to ensuring access to quality care. And we're not staking out, for example, that, you know, we're going to solve the insurance issues or what happens to the 4% of people who will not be covered by health care reform or something like that.
Okay, what I'm going to suggest is that I think that there is a place for issues that are around access to care to be dealt with by this medical board. It may not be as a separate committee, it may be as part of another committee. And as on a go-forward basis, let's try it with a place for it to take a look. Board members and the public should come to us with issues that maybe might find a home within our purview. It can be on an agenda item in a committee structure. It doesn't have to be a standalone committee at the moment. Things are always in flux. What we vote on today, we vote on today, and if the president feels that there's a need for a committee, or the public feels, or the staff feels, or a board member feels, there's no reason why it can't change. This isn't in blood and stone or whatever it's supposed to be. So I mean, it's an evolving, living, breathing document, and subject to change. So. I have a hard time personally because I believe in access to care. It's something that's very, very fundamental to me. I would like to find a place for it to be. I don't know where it should be. I don't know what subject matters it should have a purview over. I'm disappointed that the feeling is that it has not had a significant role, and that might be the fault of the participants on both sides of the aisle.
Right.
So instead of instead of throwing stones, it's not worth it. The object is that we all know that access to care is important for the quality of life of everybody that lives in the state, and the quality of the medical professional is dealt by the ability for us to license quickly, discipline appropriately, and move on. So if there are issues that are going to need to come forward to be reviewed by the Minute Clinic, when it came, was a new vehicle to deliver medical care. We dealt with it. Hetty Chang brought them to this board. They made presentations. It was a brand new delivery model. We had no idea what we were going to see. Doctors had no idea what they were going to see. And what happened, I think, as a result of her pushing and ensuring that we heard about it, we were all a lot more at ease with what was going to be delivered. And now they're in all the CVS pharmacies, from what I understand. And they're doing okay, and nobody's got any complaints. So it takes an idea, an opportunity. It needs a home. We'll find a home for an idea. We just need the ideas. So, yes, Ms. Chang, did you want to speak?
I think some of the committees we run into trouble and short of ideas. And I'm not just talking about access to care. And I think there were other programs, I could name a few, okay? The thing about it is, because it was limited amount of the board members was involved, and when we have discussions about what the topic can be. So I actually think the strategic plan is a good place to have everybody sitting together and then say, for access to care, what are we looking at? For wellness program, what are we looking at? For something else? And I think that is a place needs to happen. Personally, I do feel access to care is still the #1 important items in the medical board.
But Hetty,
yes, I know.
The solution to access to care is money. If you want to pay more taxes, we can solve the problem. But without money and resources, that problem cannot be solved. We're not in a position to solve that problem.
Well, yes, yes and no. We could go out, and when we figured out how much physicians we really would need, we go out and then send a representative to the department or to the legislation, and then say that's what we need.
Our problem is not the number of physicians. It's the distribution of where they live and work and how much they get paid. If you can solve that problem, you've solved access to care. We can't solve that problem here. I can tell you, I've worked in half a dozen countries in the past 2 months. There's no place I'd rather be than in the United States. We have better access to care here than any other country that I've visited, from South America to the European countries to Singapore. We have not perfect care, but if you're sick, we take care of you. It's not a perfect solution, but we don't have those resources, and we don't have the time and the power to do any meaningful solution. I don't disagree how important it is, but honestly, can you tell me one way that you can solve this or propose how we might be able to help?
Well,
you can't get a license unless you serve 3 years in the rural area first. If that's what you propose, I'll accept it. You can't get licensed in California unless you work in some disadvantaged area for 3 years. That would be fine.
Or increasing medical schools or DO schools, or get the real shortage out.
You take your time, take a deep breath. It's good arguments, good discussion.
So there is going to be another new medical school. There's going to be a proprietary, for-profit medical school in Sacramento, California, starting in 2012. It's incentivized by the fact that they think they can make money by teaching people to be doctors. I don't personally support the concept, but there will be new medical schools. There are at least, I think, 13 new applications for medical schools in the U.S. You know, by mandate, the state of California doubled the enrollment of medical schools in the late 60s, and that's when we had UC Davis, UC Irvine, and UC San Diego evolve. You know, we're trying to get a medical school in Merced, but again, it's finances. We don't control the things that we need to help solve this problem. And unless the board is going to say you cannot get a license unless you serve 3 years or some amount of time in an underserved area, I don't think that we can really do much.
So stop. Doctor, let's start with people that haven't spoken, okay? Dr. Carry on. We'll go around the table. I promise everyone can have an
I
opportunity.
am agree with Dr. Law that this is something that the medical board should not take as a prime issue. This is a logistic issue where doctors should be in the right place, in the right moment, and we as a board, it's not our responsibility. We can help, that's different. But it's going to take a lot of money and a lot of work, and it's not our responsibility. This is a logistic issue that I don't think we have the resources to do it. We can help, that's different.
Dr. Konadev.
Yeah, I do have examples. We do give Steve Thompson Loan Repayment Program. Money does come from licensees to encourage people to go to rural areas. That's what that money is for. We can help with J-1 visas for international graduates. We can ask CMS to fund or to consider not taking away residency spots from California, where, I mean, it's not the medical school spots which is the bottleneck, it's the residency spots. They're not funding anymore. So there are certain places we don't need to spend significant amount of our resources. We can help others. So I'm not advising or advocating that we should put significant part of our budget into this. I think we should be involved with this issue and work with the other parties, whether it is California Medical Association, California Association of Primary Care Docs, anyone, to really get this significant, serious issue in California solved. I do agree. I don't think we should spend a lot of money. I don't have any issue with that. But not involved and just pass it on to somewhere, it just dies away, is not a good thing for Medical Board of California to do.
So let me ask the question, because what I'm hearing is we have not had a definition, a good enough definition maybe of what the committee responsibility was or should be. I'm hearing that access to care is a very passionate subject. I'm hearing that a literal definition of access to care we can't control and deal with. That's not for us to do. I don't think that we should be looking at the literal words access to care committee as a definition of what we're trying to do. But what I'm hearing is that there is opportunity, in fact, to drive public opinion to a way which might ensure some kind of positive change. What that change is, I don't know, but some kind of change effective. What I'm also hearing is that some people are feeling that the Education Committee is maybe not the appropriate place for the Access to Care Committee, that maybe the Advisory Committee on Physician Responsibility might be a better seat for it. I'm going to suggest that that maybe what has to happen is we've got to do some homework as to what kinds of areas we want to have that underneath, and maybe we need to just put that on hold for now and see if people that are engaged and interested in this subject can come up with some kinds of platform or a year plan or outcomes assessment so that we could at the end of the year say this is what we did with this committee. What we call it doesn't really matter. But if it, for the moment, access to care is what seems to drive the train, that's okay. Mm-hmm. We just need to come up with something better than what I heard is all we did for 4 years. Okay, so I'm not willing to say no or yes. So I think we should.
Do we have to technically?
Do we have a motion for this? We have a motion.
Yep. Yeah. Right, to collapse or condense it into the Education Committee.
So there is a motion. So we need public comment on that motion. Does anyone have any public comment on the motion to put the Access to Care Committee into the Education Committee? No. Okay, so we have a motion on the floor. The motion is to put the Access to Care Committee into the Education Committee. If you vote yes, that's what happens. If you vote no, that's what doesn't happen. Okay?
Or at this point, is it procedurally?
Well, that's what I tried, but I heard that there's a motion on the floor.
Procedurally,
An amendment?
Yeah, okay, amendment.
Or you could withdraw.
We'd welcome an
Wait.
amendment. I basically
Or
felt
we-
it should be combined. It wasn't a standalone committee in my mind,
Yeah.
but I would welcome an amendment.
or withdraw it.
Or I could withdraw it. I'm willing to withdraw it. I'll withdraw the motion.
Okay,
I made the second and I support the withdrawal.
okay, so now the motion has been withdrawn.
Because I think from what I've heard here is that there may be something useful to have a further dialogue on this, because I have to agree with the doctor over there. I said on the...
There's 4 doctors. Just wanted to clarify that.
You know,
Just in case you weren't sure.
it is a minimal effort, but we do have monies going into Access to Care through the Steve Thompson's program. And Barbara and I have heard testimony from those individuals who are serving in those rural areas and urban communities about the work that they're doing. It's minimal, but they are out there, and part of our fees are going there to pay for that. So we have, whether we like it or not, we have begun the process already to do something about access to care. And maybe it's not enough, and maybe we're not as aware of it, and we don't want to put any more resources in that, but we're already in the business.
Right, and I believe, I do like Barbara's comment, and I just want to add one more. I believe the work Dr. Carrion and Shelton and Barbara has done on the cultural and linguistic competency, and that is a access to care issue. And it really could be combined, could be rolled into that. You know, I'm just toying with the future of how we go about this. You know, the Ultimus University program that Dr. Shelton had come through was a great program, and that's access to care. So anyway.
So I think that on a go-forward basis, since we don't have a motion on the floor at the moment, either we need a motion or we need to table this discussion, then we can just have interested parties come together to come up with some kind of an agenda for the year. Dr. Levine?
So I'll make a motion to table the issue, that in order, to table the vote on this committee,
Okay.
and to ask a group of board members and staff to come up with the work that the medical board has a role in playing in terms that relates to access to care, access to quality care, and it would include things like oversight of allied health professionals, loan programs, and other things that we think we could actually have an impact on, that whatever we call it ultimately relate to access to care. And some of those things may go somewhere else, and some of them may need a committee of their own. But until we have the work clear that we could and should do, an agreement on that, it's premature. I would agree it's premature to vote.
So could I have some volunteers, or what? A motion table doesn't need a second, so I'm moving on that, okay? So do I want to take some volunteers, or does staff want to survey? You'll survey and figure it out. Okay. A group.
I think, Madam Chair, Madam President, members, you could always direct staff, if so inclined, to figure out, do a little homework and figure out perhaps where the best fit with, right?
You're directed.
Okay.
So I have one additional comment. I think it would be nice if we could come up with an amount of money that can be devoted to this effort annually. I mean, if we know that there's X amount of dollars available every year that we can spend to help do something positive, that would be very helpful.
Oh, okay, well, that's something that
I mean,
the
I
staff
think
will
that's
take into
important because
consideration.
the thing that I took away from the diabetes effort was that they had trouble getting high-speed internet over some river to some place.
Yeah, but that's
It's kind of like
so-
that train they're having trouble with, too.
Right, so we
that was-
helped pay for high-speed internet to some grocery store or gas station or something like that.
And remember, there was no grocery store. That was
Right.
the irony of it.
Yeah.
They taught them what to buy, but there was no store to
No
buy it.
place to buy it.
Exactly,
Plus,
I
I
was
was
thinking of
really
that.
disappointed that they had no metrics that they were comparing before and after their whole
Exactly.
effort. They had no metrics.
It's government.
No, that's not, that was us.
Oh, come on, I know you're right, I know. Okay, so let's move on the agenda. Number 5,
If I could just have, so we do have a motion to table. I do believe we need to just kind of follow through with that. So the motion to table is not to take a vote on the continued, not to take
Access
a
to-
vote and deny, not to take a vote and sort of end access to,
Not to collapse access to care at the current time, to direct staff to survey the board members as to a further discussion at an opportune time. Okay?
so you want to vote on that?
No, you don't have to vote on a motion to table. You do? A motion to table is to stop the discussion.
And then that's it.
You don't need a second? You still have to vote on it? Okay, all those in favor of the motion to table, say aye.
Aye.
All those opposed? Okay, thank you. Ms.
Okay.
Kuchmeyer?
Moving on to the Advisory Committee on Physician Responsibility in the Supervision of Allied Healthcare Professionals. And again, this is at the bottom of 50.3. This committee is the logical committee to deal with the SB 100 requirement of determining physician availability in cosmetic surgery settings that use lasers. This is a requirement for the committee to look into that and develop regulations. Based upon the comments, there is great interest in keeping this committee. Staff recommends that this committee meet off-cycle of the quarterly board meetings. So I'd like to entertain a motion to keep this committee with the issue listed in the report and to meet off-cycle.
Motion?
Well, no, a comment, I guess, but.
A motion? It's going to die for lack of a motion.
I move that we support and continue this committee.
Okay, thank you, Dr. Lowe. Do I have a second?
I'll second.
Oh, a second, okay. So do I have some comments from board members on this?
Yeah, and I had gotten some questions from members, or at least attendees of this committee who were not board members, because as you recall, there had a number of interested parties also be members, and they were concerned that it wasn't meeting, and they felt very strongly that it in fact continue, and in fact not be limited to laser, that was too focused, no pun intended, but that physician responsibility in the supervision of allied healthcare professionals is much broader than that, and I think it was perhaps a little easy to kind of write it off as, well, it's that cosmetic thing and the Medi-Spa thing. And we see it, at least a number of the stakeholders saw it as much broader than that. So I do think it has a role, and I would want it to not be just limited to some kind of a turf battle with doctors and techs or whatever these aesthetic laser-wielding people were that we met at those, symposia. And because it is a medical issue, and so I guess I am, I'm not sure that I'm willing to say it should exclusively be off-cycle. Maybe it's going to have to be, but since I do think SB 100 is such a big issue and it's a licensing thing as well, I guess I'd like to think it might still have room in the board, especially if we have committees meeting concurrently, now that we have more members. So, long sentence, I'd like to support the motion to continue the committee, perhaps broaden its charge, and consider it still be in the board cycle and off-cycle if necessary, but at least still look at having it in the board
The
cycle.
expectation of the committee when it was started was not to be just related to cosmetic and Botox.
Correct.
It was supposed to be an opportunity to take a look at how the medical profession could be more collaborative in its practice and oversight of those medical extenders, whatever the correct term is, and to make sure that that the doctors were in a position to lead that discussion to be how they could be more collaborative and give up responsibility or take more responsibility, whatever. So to move it forward to an off-cycle gives the opportunity of the committee or task force, whatever it's called, to have a broader and deeper discussion with more people to come before it, and then for it to report back to the board. So the issue is, for us, is that should this be a regular committee to deal with these issues off-site or at the same time as a board? That's one issue. And the issue is, should the scope be limited to what it is suggesting currently, which is just the implementation of SB 100? Dr. Diego.
I was going to say, just like Dr. Solomon said, especially in view of 2014, we do have to make sure that we're broadening the scope of that committee, because we are going to see that somehow we have to take care of Californians, and one way that people will look at is allied health. So we need to protect the public, right? And that's our responsibility. We need to make sure that we're thinking ahead and we're figuring out how to do that, and that we're not stuck in the Botox and the cosmetics.
Yeah, no.
Yes, I
Before it
agree.
hits us.
Before you get a shot of it, yeah. Kim.
One thing I would like to add as far as meeting off cycle for this particular committee as well, with the first agenda item or the first issue that's listed in your packet for this committee, it's going to be meetings that when you're looking at setting up regulations, you need to have interested parties meetings that take longer than usually our normal hour at a committee meeting. So you'll want to extend the time of the committees, which is why we would recommend that you meet off cycle on these, so you can have robust discussions before you set up regulations and as you walk down this path, similar to like our interested parties meetings we've had. So that's kind of why we had thought for this particular committee, meeting off cycle with these individuals would be a better fit for this committee.
And then Kim, I'm sorry to interrupt, Madam President, members. So Kim, if I can just be candid, then it would be there would be nothing stopping the access to, I'm sorry, this committee, just has a long name,
yeah.
From reporting back to the board on cycle, so to speak.
Absolutely.
It was to be expected
Yes,
to be done
would
that
be
way.
right.
Okay, Dr. Ganadel?
I think this committee is important. I don't have any issue with that. I'm just trying to see, are we trying to look at AB 100 and divide that multiple parts into each different committees? I thought licensing was looking at most of the issues related to licensing of the outpatient.
Dr. Ganadev, this is something different. SB 100 contains a specific statutory provision that the board shall adopt regulations regarding the appropriate level of physician availability within clinics that use laser or intense pulse light devices. So it's something standing alone from the outpatient surgery center issue.
This is what you're suggesting. This is in addition to the mandate of this committee to deal with SB 100 as well as the other issues?
This would be their one main issue at this time for its goal.
This would be the one main issue at this time.
The one issue that
So
needs to
this-
be taken care of at this committee at least first.
So this is, again, we're at the same place where we were 5 minutes ago with the title of the committee and the expectation of what is going to happen at that committee to be not in sync. What I'm hearing is that the need for having in-depth, robust discussions with interested parties having to do with physician oversight responsibility in a collaborative manner in order to deliver health care safely to the citizens of California versus implementation of SB 100.
Yes.
So I want you to understand that I'm not the only one hearing the conflict here, correct? So I'm going to suggest that I think that somehow where we're getting to is that each committee is not as well defined as it needs to be. the expectations of what needs to transpire within a year to look at positive outcomes and measurable, accountable, transparent opportunities is not in place. So we have to work on this. So let's take a look at this advisory committee on physician responsibility and suggest that number one is a participant, not the only suggestion. Okay, so let's understand that. We're okay with that?
Yeah.
And that committee then will broaden its scope, because I'm very conflicted with having the decision to implement the committees be predetermined by without a discussion. Everyone went and discussed with Janie on the interviews, but obviously it's not coming back in the same, it's not coming back. Trust me, I'm hearing it from here and you're hearing it from there, and we're not hearing the same thing. What I'm hearing is that this example is that SB 100 will be the focus of this committee. What I'm hearing is that this committee needs to be a broader,
Yes,
fuller committee.
and we understand that.
Okay, then we do here, okay.
But this is one issue that is
This is an issue.
before
This
this
is an
committee
issue.
at this time. Right,
Address.
right.
Statutory.
And you're also hearing that licensing thought that licensing was doing SB 100, correct?
So, Madam President, members, just so, as the counsel to this advisory committee, I'll just say that because it's a lot shorter than saying all the words. With the committee, the focus, I think, on elective cosmetic procedures, lasers, and IPLs has because it's been statutorily driven. The legislature has told us to go do this sort of thing. In my mind, there's nothing from stopping this committee from considering a whole host of advisory and allied issues. It's just that they have not bubbled up to the surface as much as the legislature telling the board to go do this. As far as the IPLs and the lasers and the physician available, this seems like a logical place to at least start when the board considers regulations on that area. And I would respectfully suggest that we are sort of in the same position we were last time, which is we have a motion and a second just on the continued viability of the committee. So whatever direction we go, we have to dispense with that motion and second.
Okay, so do I have some more comments or any? Yes, Dr. Ganadov.
Yeah, I
have a
just,
question.
only thing I'm asking is, does this need to be on this committee or licensing can do it? That's all I'm trying to see.
Okay, let's
Why
have a
are we-
clarification from our executive director.
Okay.
We need a lot of input from interested parties, and the work of determining physician responsibility or availability in these settings is going to take more time than it would in a regular licensing meeting. And you have to remember, SB 100 has a licensing component, an enforcement component, and it, for this board, of course, the accrediting agencies is a major component, but it also has a regulatory component that doesn't necessarily fit within either the enforcement or licensing committee per se. So that's why we've divided it up.
So let me ask you the question, can SB 100 be its own committee? Dr. Levine?
Yeah, I mean, I think what's beginning to dawn on me is that there are pieces to a to a regulation or a piece of legislation that need involvement from multiple committees. So as an example, to me, one of the issues around physician responsibility for oversight of allied health professionals is a large percentage of the physician population has no clue what their responsibility is. So the education, it's perfectly feasible that the work of this committee could then be handed over to the education committee to figure out what's the best strategy for educating the public and the profession about this responsibility of the profession. So rather than trying to jam it into one committee or another, I think we're better off looking at what are the issues we're dealing with and which group of people as currently constituted can deal with that piece of the issue.
Perfect.
And it may be multiple committees actually involved in a single idea.
So we don't want an SB 100 committee, is that what I'm hearing?
No.
Okay, who else? Dr., Ms. Chang?
You.
You.
Well, there's a little bit of a, I'm just asking this question, it's just about the scope of practice, you know, in the future. Is where does the doctor do, where does the nurse practitioner do, where does the PA do, okay, or whatever around it. Where would that fit in? Or would that be an issue that the board is interested?
Well, I think access to care, but I don't know. I don't have an answer. Do you have an answer where that would fit? Dr. Levine?
So currently, I think scope of practice.
Scope of practice,
For
what, yeah.
the most part, is defined in statute. The legislature, the state legislature essentially is the decider. There's a lot of process involved in that, but currently the state legislature sets the rules around scope of practice. My guess is that this board is going to be involved, and it may be one or more committees, in opining on legislation introduced to expand scope of practice or narrow scope of practice. These are largely, at the moment anyway, turf battles.
Well, it's a turf battles, and it will be a nationwide.
No.
No, you don't think so?
No, I don't, because currently, at the moment, it is the state that regulates the practice of medicine in the state. And so I think these are very different currently across the country.
It's states' rights. That means the question, it's to get to some kind of a federal situation, we're not, I don't think we're there yet, but
We're a long ways.
we're a long ways away from that. Unless they're going to go by our rules.
So you're saying it's really not a medical board issue?
Oh, it is, as long as it's a California Medical Board issue.
Sure.
Okay.
Well, I think we can recall, and I'm sure Dr. Bishop knows the issue well, when the previous administration chose to opt out of having physician supervision of nurse anesthetists.
Right.
I felt strongly that the board should weigh in on that. I was a minority voice. The board felt very strongly that it shouldn't.
It was a reimbursement issue, wasn't it?
It was a supervision issue, and supposedly the Medicare opt-out required input from the board, but it was felt very strongly that that wasn't asked for, should not be offered. So I think it's very clear
Wasn't there a
that
case, there was
scope
a
of practice
court
is
case going
not
on,
the
though.
purview of the board.
Okay, so Ms. Kirchmeier, did you want to help us out here?
If it came to scope of practice, I believe that would probably either be under the executive committee, because at that point it would be, as Dr. Levine said, it would be an issue that came before you as legislation and a review of a bill that was brought forward to change scopes or expand scopes of practice. So I think that would probably be something either under your executive committee as legislation or under the full board when Ms. Simoes would bring it before you at a full board committee. So that would be scope of practice. Going back to this committee, one thing I would just like to add is in hearing what Ms. Chang had said on the Access to Care Committee information, when she was talking about allied health and physician availability for those and how that all fits together, I did kind of make notes, and I think Ms. Whitney did as well, saying that that was actually the appropriate place, probably not Access to Care, to bring it into this committee. So that's something I think we can take back and discuss and see how that kind of fits into this committee moving forward, so we can broaden it and actually fit back to, if you look at page 50.10, into what the true definition when this committee was actually developed, which is definitely beyond lasers, beyond Botox and all of that, and does go into the allied healths themselves. So I think we can actually do all of this under this committee, but still going back to the one main issue that we would like to bring forward first is the SB 100 regulations, because it does seem to fit under this committee.
Okay, thank you. So,
motion on the table.
Yes, sorry.
And as you look at also, can you look at a better name than what you have there with all the stuff you are adding on? Okay. That name specifically defines something which is not what you're including on. I think it's a great idea to have all those in one, but come up with a different name which corresponds to the duties, what are the responsibilities of that committee.
Mm-hmm. Right. Thank you. Any other comments from the board? Mr. Hepler, would you please help us along here?
Thank you, Madam President. Members, my notes indicate that we had a motion and a second to retain the viability of this committee as it's currently constituted and have that committee meet off cycle for the purpose of bringing back comments and findings on cycle being within the regularly scheduled board meeting. So I kind of think that's where we are.
So if we support it, we keep it, but if we don't support it, then what happens?
We have longer board meetings.
I think most people believe in concept that this is essential. So, I mean, I don't mind withdrawing the motion, but what's the alternative?
So it's my recommendation to consider an interested parties task force meeting where this is really looked into further, that issues are brought forward where they need to be, experts come in or interested parties come and speak, and that get reported back, and then see how the meetings go. I mean, the issue being is that if there's going to be substance to physician responsibility, engagement, and collaborative practice, in addition to SB 100. See, I'm seeing SB 100 as one part of it. I'm not seeing SB 100 as the only part. If it's the only part, then have the meeting here.
I would certainly agree, but this already is a committee of interested parties, right?
It is.
Already.
It is.
That's what it is.
It is.
Yes.
I mean, if you look at the list of people on there, it is all the interested parties.
Right, so it's up to staff to convene the meeting, and it's up to staff to move that forward, and that needs to then happen. The issue is, I guess what I'm hearing is, are we going to meet off-cycle and report back, or are we going to meet during the board meetings?
There are two issues. One, do you want to keep this committee as it's named and the individuals on it, which are more like an interested parties committee, and you still would need a chair to then meet off cycle to bring back information not only on SB 100 but other issues that are relevant to that committee? Or do you want to disband that committee and have staff work on these issues in a different forum?
Oh, can I have
And
a
so
question?
that would be the alternative.
Well, what does the staff want to do?
I think we feel that this committee is appropriate for this regulation process.
And I don't have a problem with broadening their responsibility. I mean, that's fine with me.
But I think
I would suggest that the difficulty we're having today speaks volumes to me, that this is not something that we can ever take care of, at least initially, in a standard board meeting. I'm sorry. I think this, the difficulty we're having today discussing this and coming up with any sort of decision speaks volumes that we can't deal with this at a standard board meeting. I think that this should be taken off cycle where we can address it more appropriately. I think we have a committee that has interested members who can start that way. As you've mentioned, this is a working process. This is a living committee. We can band and disband, add and subtract members. But I think we're getting bogged down in such minutia that we're losing track of the real problem. That is that we need to deal with this problem by statute, and this is a good place to start. And we have a committee already that's working on this, and I do think we should take it off cycle for the sake of this problem. Obviously raises great interest, great issues, and I think we should give it that sort of attention.
I mean, the key is the chair of that committee.
correct.
Right, which is not a big deal. I can appoint a chair. That's never been the issue, in my opinion. I'm happy to, you know.
Madam President, members, I'm
So to make that happen, if that wasn't, I didn't know that was an option. My concern is that it's being limited to SB 100.
right.
And I think that we're all having that issue, Ms. Kirchmeier.
Initially,
Initially.
I mean, that's not an issue. I think you combine with what we've put here as an issue in addition to what we have here as the definition and purpose of this committee.
But the definition and purpose of this committee has been defined by not the people sitting around this table. SB 100 was not there, is not there. I don't see SB.
You're right.
Yeah, but what you're adding SB 100 to this, what I'm hearing is SB 100 is the issue. I'm not hearing a combination, and I don't think anyone else is hearing that.
I think we have a.
Yes.
The way I look at the staff recommendation is that this is in addition to the existing description of this committee, which is on 50.10, and that this would be the primary focus initially because there is a statutory mandate, but not that it's limited to that particular SB 100 issue. Right. And if you look at the responsibility as it's defined on page 50.10, you see that it is broader than lasers and cosmetic surgeries. It's to study the responsibility of physicians in the supervision of allied health professionals delegated to perform procedures in order to ascertain what action should be taken to ensure responsible supervision. And the goal of the committee is to determine what regulatory, legislative, or enforcement actions need to be taken to ensure patient safety and report those to the board.
So let me, in all fairness, let me just suggest that that was the expectation a year ago. That never happened. Okay, so understand that that never happened. That was the original expectation of that committee structure, and now that committee structure is having added SB 100 to it. So the issue is it going to meet off cycle? Is it going to meet on cycle? Is it going to be as defined here? So let's keep our comments to that being the issue. But everybody needs to understand very clearly that the focus of this committee was never intended to be lasers, and it should never be intended to be just SB 100. So I want to make sure we're all on that page to start with, because I'm hearing up until 10 seconds ago still that conflict.
So the motion actually on the floor, as I understood Ms. Kirkmeyer to statement of it, was to keep the committee as is, which means the existing statement of responsibility, to meet off cycle, and to add this one SB 100 laser IPL issue to it. Is that a correct statement?
That is correct.
Okay. So do I have any more comments from the board members? Do I have any public comment? Yes, okay, I have public comment. So come up, identify yourself, and when you're finished, you'll fill, oh, you have, thank you very much. And then Ms. Manassian will hear from you as well.
Madam President, Tom Riley with the California Society of Dermatology and Dermatologic Surgery. And I just want to commend the board. Even though this was a complex discussion, I think all of the appropriate comments were made. I think you understand the issues. I just want to urge the board. SB 100 is very important, and it's important for two kind of schizophrenic reasons. One of them has to do with the licensing, but the other has to do with what the doctor's responsibility is inside of those facilities. And that's the part that we were ever so hopeful when this committee was formed would be addressed before SB 100 was around even. With respect to the fact that SB 100 is now, the time clock is ticking for the regulatory process, it makes the work of this committee, in our opinion, even more important. So we would urge the board, move forward, find a chair for the committee, be aggressive, have public input, and then if after that process there are other things having to do with scope to be addressed, use that committee to address those other things. Thank you.
Thank you. Mr. Riley. Ms. Manassian, would you like to speak?
Good afternoon, Madam President and board members. My name is Tina Manassian, here representing Consumers Union Safe Patient Project. Since the Advisory Committee on Physicians' Responsibility in the Supervision of Allied Healthcare Professionals will include discussion of aspects of the implementation of SB 100, it's important that this committee remain on schedule with the quarterly board meetings. Please make sure that the public has access to the implementation of SB 100 by keeping this committee on schedule with the quarterly board meetings. Thank you.
Thank you. So I'm going to call for the vote. Would you remind us of what the motion is, please? Make sure it's...
Would you like me to do that, Ms. Kirkmeyer?
Please, Ms.
The motion was to keep the committee as is, which means it retains its current statement of responsibility, to meet off-cycle, and to add the SB 100 laser IPL issue to its tasks.
Okay, so that is the motion. All those in favor of the motion as read, please say aye.
Aye.
Any opposed? Okay, so motion carries. Thank you.
Education Committee. Before we get to the members' comments, I would like to revisit a comment that was received at the last meeting. The comment was from Michelle Montserrat Ramos from the Consumers Union. The comment was intended for the strategic plan, but in looking at it, it is more applicable under this agenda item. Ms. Montserrat Ramos asked the board to educate the public on how complaints are prioritized as well as the legislatively mandated priorities. Another comment was to increase the priority of expanding current outreach to the public and provide information on the board's programs, patient rights, and how to file complaints. These suggestions really fit under the Education Committee and are issues the committee could get involved in. So we'd ask that those would be added. Turning to the page 50.4 and 50.5, that's where you'll find the Education Committee comments. It appears the committee may need more specific issues and member discussion. It does not appear critical that this committee meet during the quarterly meetings. Again, I ask for input from the board members as to the direction on this committee.
So may I have a motion to approve the Education Committee as stated by Ms. Kirchmeier? To maintain, correct?
Well, at this point, based on the comments, I just wanted discussion. There was kind of, it was kind of a split in looking at the members' comments on this one.
Okay, so would you like to review what you're looking for then, please?
Yes, I would like some direction. The one issue that was put forth for the Education Committee, so there is one issue. I wanted to ask if there was anything else that anyone wanted to add based upon members' comments. The one issue right now that we're recommending that be looked at is the requirements of SB 380 related to education material regarding the prevention and treatment of chronic disease. That was something that was actually in SB 380, and in looking at implementation of the legislation that passed, that appeared to be one that would fit definitely under this committee. So in addition to that, is there anything else that members would like to see as an issue for the Education Committee?
I think we're going to say the same thing. I have to admit, I'm puzzled at the board's role in educating the public about the prevention and treatment of chronic disease. And we have specialty societies whose full-time job is educating physicians and patients about. So, I mean,
it's the first I've heard of AB 380.
Yeah, so is it within our purview then to ask the specialty societies in the state of California what they are doing in regards to this? Is that one way to carry out that?
If I may clarify, this piece of legislation did pass, and it directed the medical board to put together a work group or informational meetings regarding chronic disease and what could be done to educate the public. So it is a mandated function that we have to do within, I believe, the next 2 or 3 years, and that 3 years, sorry, and that was reported last meeting in the legislative updates. We have to implement it within the next 3 years.
Dr. Ganadev?
Maybe I'm being the rookie at the green here, but what does the Education Committee exactly do? That's what I'm trying to figure out. And I just heard from Linda that there is something about some mandated
Take a look at
work, so
50.11. It's to serve the board as an advisory body on public and licensee information issues, develops informational materials for publication, internet posting, work with the media, develops recommended communication strategies, policies, and programs for the board, monitors and reports the board's strategic communication plan. So SB 380 could be an informational piece in the newsletter. And then you've done your job.
You would convene one interested party meeting, discuss the topic,
it's
and
not
then put
a
it
major.
forward.
Okay.
So they kind of decide what they want to do. So what is it you'd like to garner from, what is it you want us to tell you?
If there isn't anything else to add from the members on issues, then I would recommend that we move forward with having this one meeting, and then move forward also at that meeting to discuss issues that the committee would like to bring forward. Again, we do have the consumer union items that I did bring forth as well. From their comments regarding information for complaints processing, and that would be something like we had done in the past to bring forward through this committee. So
I would suggest that the committee convene and have a discussion on what they want to educate about. I think that all the committees should be doing that. I don't think that this is the forum for a discussion of what the committee should be discussing.
I think that's one of, I think I repeated myself now again.
Well, we might hear you if you keep repeating yourself. It's okay.
I know. It's one of the committees that we do not have a sit down and say, what do we want to really discuss, and then sit down like what we do strategic planning in the beginning of the year. We end up just kind of float with it. So I thought for the committee to sit down and say this year, let's look at what we're doing. It's something like that.
I would suggest that every committee should either come up with a plan or a program, what it wants to achieve during the year, and report back to the board how successful they were, what were the issues of concern, what didn't work, why it didn't work, and how we can do it better. I mean, we should always be evaluating what we're doing. I would hope that the Education Committee has done some good things over the last few years, but as chair, I can't tell you exactly what. We could defer to Ms. Kirchmeier and ask her what we've had on the agenda for the last 4 years, though.
Yeah, I think the signage was the project that.
Pardon me?
The signage.
Oh, the signage in the office. That's all?
no. There was the cancer brochures.
Changers in cancer posters. We've done some things, Dr. Gunnedev, I apologize. I'm freezing cold, so my brain is not really functioning, I guess. It's also getting late in the day. Yes.
Madam President, members, watch me demonstrate my lack of acumen in all in one shot here, okay? Ms. Kirkmeyer, I have to be candid with you. I'm a little bit confused. I thought the goal of this was to determine whether the Education Committee had continued viability, that is, it would continue to exist. That was a question before the board. My presumption is that by saying that we're going to have a meeting to discuss that, is that the board has already made its decision that the Education Committee is going to continue to exist, because it would be difficult to have a meeting of a committee that didn't exist.
No, and based on the input from this committee, if you choose to move forward with it, then you would make a motion to keep the committee as is, adding in, back to the other one, adding in the SB 380 requirement, because it's a mandate, and then moving this committee forward with the meetings.
Okay, so I have a motion to that effect?
So moved.
Second.
Okay. Do I have any public comment on the motion as stated? All those in favor of the motion as it's stated, please say aye.
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 Any opposed? It stays.
Okay?
And you add in 380.
Yes, we will. And we'll also bring forward the goals for the future. Physician Recognition Committee. Based on the majority of the comments, this appears to be a committee the board has determined may no longer be a priority and should be discontinued at this time. Based upon the comments, if this is the board's direction, I would entertain a motion for the discontinuance of this committee.
May I have a motion?
So moved.
Do you have a second?
Second.
Any public comment? All those in favor of the motion as stated, please say aye. Any opposed? Okay, next.
Okay. Wellness Committee. This was another committee where there was a suggestion to combine this committee with the Education Committee, and also a comment to eliminate this committee. There was also a comment to evaluate the impact of the information from this committee. Based upon the comments and looking at this committee goal and what has come out of the committee in the past, we would entertain a motion to move this committee to the work of the Education Committee.
Interesting.
It's very interesting. I'm just kind of like,
we wanted to put everything in the Education Committee, yet we didn't want the Education
we don't want
Committee
education.
to continue.
All right, so what I'm hearing is that the suggestion is that we move the Wellness Committee to the Education Committee. So in order to do that, in order to have discussion on that motion, we would have to have a motion to approve that. Do I have a motion to approve it? I don't, I do have a motion?
There's a motion.
Oh, Dr. Bishop, do I have a second to the
Yeah,
motion?
second.
Okay, so now we'll have discussion.
I would suggest that perhaps the problem we had in the past with the Education Committee, it didn't have a clear set of goals. Now we do. We're assigning it clear goals now, so I think what you're saying is true, and we are assigning it clear goals to maintain its viability and usefulness.
So, from the chair of the Wellness Committee, did you want to say something?
Well, I just would say that this committee does have a well-defined purpose and goals. If we go back and look at the work that it has done, I think the problem is, realistically, is given the medical board's priorities and their core functions and the availability of resources truly, and the fact that when we factor in other institutions having their own wellness activities, in my mind, as your chair, I think that it either can be combined or eliminated. And when we get, if we put it in the Education Committee, it may be that it could be discussed in that fashion.
So let me ask you a question, Dr. Drousseau.
Yeah.
The purpose of the, and for Dr. Bishop and Dr. Gennett, I'm doing this more of a, for your information, so you should understand where this came from. The medical board used to be in charge of a diversion program that was a failure. In evaluating of what could be done on the next steps, when the medical board decided not to participate in the failed opportunity, the diversion committee, not diversion, the wellness committee was established, knowing full well that there are people who are experts out there who do this, there are experts out there who know how to do it, and there are experts out there that want to do it. The issue being that this was a task force more than a board committee, so it had interested parties as well. And at the same time they were meeting, the state interested parties had a law on the books that they would have to define what would be a program, if it were to exist, what parts it had to have of the diversion program within it. So to that issue, the diversion program, the wellness committee met. This is nothing, this is okay, that the outcomes of that meeting were as well publicized as it might have been? Maybe not. Were they publicized at every meeting? Yes, they were. Were we looking at the issue that every hospital has a wellness committee within the hospital setting that should be dealing with these issues? Were we taking a look at the medical schools who in fact were telling us they were dealing with this issue with students? They were. Could we have been doing more? I don't know. Did we make our position known well enough? I don't know. Should we continue that? I don't know. But by the same token, there is a need for figuring out what to do with it. You're absolutely right, Dr. Bishop. Shelton, I don't know, your recommendation is keep it or lose it, so you got to give me more than that.
Well, well, there's a motion on the floor.
Right, but you were intimately involved with this for the last year. I would like to take your position and I'll, try and push it. Merge it or lose it. Lose it or use it. Lose it or...
Well, let me put it this way. If we don't have adequate resources to get the job done.
It means adequate staffing?
Staffing, I mean, you got to have time involved with this.
So, Dr. Bishop and Dr. Gennett, you should know that we've been down tremendously in staff as well as board members this year to the point it has impacted the committee structure at meetings. You should understand that very clearly.
We don't want to give the public the impression that we're going to deliver something and not deliver.
Correct.
That's not good, dealing with the public and the ethics of this board and the reputation of the board and that sort of thing. And so, this board, then, if we continue this activity, we need adequate resources to go forward. And and we haven't been able to have adequate resources, it's not our fault, or
It's nobody's
Their
fault. It's nobody's fault.
Is
It is what it is.
It, decided to cut back on this, that, and the other. So, and I don't have a good feel for what's on the horizon in terms of available resources in the future.
So would your recommendation maybe for now to put it into education, to see if there's a need for it to continue, to see what the purview should be, how to engage and inform the public broadly, or would you recommend that we just disband it?
I would recommend that we put it in education.
Okay, that's what I was
and then we can have
looking
a real debate about this.
Okay, I was just looking for some kind of direction. So you've heard.
Yeah.
Okay, so I want to thank you. Is there any more public comment? Dr. Ganadab?
I'm just curious. The issue itself is so important. I'm just curious, what is this committee doing actually with the physician wellness itself? So is there something we are doing already is going to be eliminated, or we are not doing much, but it's going to be, so it's going to go into the education committee? I wasn't sure what this was.
Basically, this committee was set up to keep the board, licensees, and healthcare administrators informed on the benefits and availability of other resources to renew and balance a physician's life. We've had many articles in our newsletters. We've tried to have an article in every newsletter since this committee was first established, but we didn't have the resources to help staff that committee, and so some of the newsletters went without a publication. But if it were incorporated as a possibility within the Education Committee, not only could you discuss new avenues of communication with licensees and administrators to ensure that they're well informed about issues of well-being and wellness, it could be expanded in the Education Committee if there were other information that came up. So it is a committee that was established to inform. So to integrate it into education is a reasonable possibility, but it's also a very important issue that this board saw as something that had to be addressed for physicians, because well physicians basically led to good quality medical care of the consumers. So that's kind of what they were looking at.
So I'm gathering that the function is not being eliminated, it just moved to another committee.
Right. So at the moment, so the motion on the table is to move this to the Education Committee. There's been an opportunity for the board to speak. There's been the opportunity for the public to speak. Correct? Yeah. Public comment. Anybody like to speak? I apologize. I thought. Okay. So all those in favor of the motion, please say aye.
Aye.
Those opposed? So that's done. The next one, Ms. Kirchmeier, and
the last one.
Thank you.
This is the Cultural and Linguistic Competency Work Group. The comments on this item, again, were split as to whether to continue the work group or not. I would like to ask if there are any other comments on this committee from the ones that I received via email, and what its issues and goals should be. In addition, if you keep this work group, should this meet off cycle from the regular board meetings? So at this point, I would actually entertain a motion based on the comments from looking at it and from the members. It's up to the members at this point, the furtherance of this committee, because there were splits, so there was no clear direction provided.
Okay, I'll speak. I just want to say something. This is very important to me, and I'll tell you why. Cultural and linguistic competency takes in more than the person that lives in California that doesn't speak English. It takes into effect the person that has mental deficiencies. It takes into the effect the elderly, the demented. I have a feeling that the scope of this committee has not been defined widely enough, and the impact we can have as well might not have been as effective as it might have been. We've had some very good, robust discussions. We've had some very good people come and speak. Dr. Carrion, would you like to speak as chair of that committee?
Yes.
Thank you.
I think that this group of doctors, we have a very clear objective. And we brought two of the national and international experts in this issue. More than that, I think that we reach a preliminary conclusion that if we are not supported by the legal system to obligate, quote unquote, the providers, as for example, for renewing your license, you need to have some hours in pain management, in pain medication. Consider that today in California, 40% are Spanish-speaking plus another ethnicities that we covered. This is an issue that affects the quality of care. Because the communication in hospitals, for example, in the hospital that I work, we have serious problems in communication, and sometimes you miss a diagnosis because you don't communicate well with the patient. Now, how it's going to be done, this is something that the experts are going to need to tell us. But basically, I think that this is a committee that should be in place, and I feel that, again, the legal system is going to need to be involved in this.
Yeah.
Dr. Dussault?
If I'm not mistaken, I believe the medical board is responsible for implementing SB 1195, which has to do with overseeing or monitoring the activities of this. And I didn't read anything. If we don't have it, what are we going to have in place to satisfy SB 1195?
So let me ask you a question, because Ms. Whitney has just given me what I think might be a shining light.
Oh, good.
And that would be to entertain a motion to merge the responsibilities of the Access to Care Committee with the Cultural and Linguistic Committee, and hold a meeting to see if the new mission and goals can be defined with clear objectives.
Beautiful. Excellent.
Actually, I was
Oh, that's
going
what
to
it is,
ask
a big
about that because we talked so much on access to care. And access to care is most deficient in linguistic minorities. That is the real issue in California, as well as the rural areas. So it is important, but as far as any kind of mandates on physicians, I have this opinion that we should never mandate that physicians too should do a CME for breast cancer, a CME for pain management, a CME for linguistic competency, CME for this and this. So I think that's, in my mind, it's not a right way to go, legislation for every CME. But
I wasn't going for CME.
No, I heard about the CME and linguistic competency, so that's why. But the function, I think this committee and the access to care, they're intertwined. It is so intertwined. It's just it's just a good way to merge and come up with a maybe better name.
So would you like to make this motion?
Yes. Don't ask me what. No, I'm just.
I have it written up. Second. And okay. So do I have any discussion on the motion? Have any public comment on the motion? So the motion is going to read to merge the responsibility of access to care with cultural and linguistic competency, and hold a meeting to see if the new mission and goals can be defined with clear objectives. And let's do it off cycle so we can spend the time we need to spend.
Yes.
Okay. All those in favor of the motion, say aye.
Aye.
And opposed? Thank you very much. Ms. McCutcheon.
Thank you. There were no other comments on committees. However, if there are any other committees that the board would recommend that we have at this time, otherwise, if there aren't, as there weren't in the comments that were received, then I'm finished with this agenda item.
Thank you. Dr. Levine, I saw your hand in the air.
I'm sorry, I don't know what SB 1195 was.
Believe it is.
Linda, you might want to refer to it to get it right.
That legislation required that the medical board set up a work group to determine if those individuals providing continuing medical education were in fact incorporating cultural and linguistic portions of their training to the aspects of how it meant or how it applied to the different types of training given, such as if you're doing a cardiology class, you might talk about the different cultures, races, and sexes, how it impacted them. So we were just supposed to determine if, in fact, the CME providers were doing that correctly and had included that within their training.
So it's auditing the CME providers?
Correct.
Yes.
Correct.
Yeah.
Any CME after SB 1195, I think, right? I'm just forgot the right word. Every CME lecture or a program has actually an item. Cultural and linguistic competency was discussed. It's a requirement that anyone who gives CME program has to have that. So that was actually a compromise between having a mandated CME for doctors versus nothing. So that's what came as a law there. So it is being done. I think what Dr. Levine asked is, are the CME the one who is accrediting agencies, are they auditing that stuff? And my understanding is they do, but I don't know.
Did I miss Chang? Did I see another? Mr. Schmeier, thank you very much for your presentation, and thank you for assisting us in trying to get this done. We are going to recess till tomorrow at 9 o'clock. For those of you on the board that are joining us and staff that are joining us for dinner, you need to be in the lobby in 5 minutes. Dinner is at 6 in San Mateo, and Happy New Year, Hetty.
Thank you. And
Dr. Lowe.
Dr. Lowe. Thank you. Happy New Year to all of you, too. It's a brand new year. Year of the Dragon.
The water